Hi, it's Sarah, and this is a response to a new week's hope topic for this Monday. And I can't remember for the life of me who generated the topic, so I'm very sorry for that. But it's a really good one. It's about drugs and their place in eating disorder treatment. So I am going to give you my spiel on that. Do I think they belong? Absolutely. Chances are you took every measure possible to get so sick and this unhealthy that you owe it to yourself to try everything to get well and to get as well as possible as fast as you can. So yes, I do think they belong in the setting. There are two things that I want to underscore, though, as someone who hopefully goes into the medical field as a physician. That's what I'm looking to do, not psychiatry. I think psychiatrists are mad. But one of the things is that drugs do not work the same on everybody. So one thing that I can imagine driving physicians mad would be someone coming in saying, oh, well, my friend tried it and didn't like it, so I don't want to try it. It doesn't work that way. Our bodies are so different and our body chemistries are so different that, one drug can work for someone and not work for the other person, and they can be in the same family. That I've known to occurs in my family. I took a drug that made me pretty much suicidal, and it works really, really well for someone who is a blood relative of mine. So you can't really base your experience on that. And then the second thing is that it's trial and error, lots of trial and error. I don't know of anybody who hasn't found something that's worked a little bit for them. But I know people who spent years trying. I'm one of those. Most of the antidepressants we use today are SSRIs, or something along those lines, and they have to do with neurotransmitter reuptake. And the thing is that serotonin is not only regulates your mood, it also has a huge role in sleep, and it also has a huge role in appetite. So if you're not sleeping and you don't eat, it's going to take a lot longer to work. So these things take 6 to 8 weeks when you're healthy, and if you're not, presumably having an eating disorder, it can take a lot longer. For me personally, it took almost a year for one of mine to start working. The second thing, in terms of my drugs, the second part of this is what I was going to talk about, my experience with drugs, or with these drugs. I've taken Celexa. I didn't find it helpful. I'm hoping to try it again in conjunction with another one. But I was very young at the time, and it's not approved for children under 18, and I was 17. And it can lead to suicidal ideations in young adults and teens. And then I tried Prozac. I couldn't sleep at all on it. It just did not work. I can sleep better on straight uppers than I can on Prozac. I didn't sleep for 2 weeks. But then again, I know some people who are out cold once they take it. I was actually quite lucky. I lucked out on my third drug that I tried, and it's an SNRI. So rather than just a serotonin, it also works with the norepinephrine. So it's got an anxiety component to it too. I found it really helpful, especially in terms of obsessive and compulsive thoughts. There's a certain amount of that in the ED, or in the eating disorder part of it, and I found it really, really helpful that way. But it did take a long time to start working, and I actually ended up on a fairly large dose. There's also a class of antipsychotics that I've taken a lot of. There was a study going on in my clinic at the time, and it was talking about olanzapine and eating disorders. So they were treating anorexics with olanzapine. Very, very, very small doses, so not the same doses that psychotic people get, very small doses. And it worked wonderfully. I owe my life to that drug. I was able, like, there are side effects, and yeah, I hated them, but I managed to gain the weight. I managed to get to a place where the anxiety was low enough and my thoughts coherent enough that I could reason my way through an eating disorder. And I was on it for a lot longer than most people are supposed to be on it, but it worked. I owe my life to that drug. I am healthy today because of it. There are a couple of others in that sort of grouping, risperidone and Seroquel, and I've used both of those. I consider them milder than olanzapine, but again, some other people would beg to differ. I've also taken a couple of mood stabilizers. I don't really like them. There's a lot of side effects to those, and I'm allergic to one of them. So yeah, it's basically a lot of trial and error, and everything works differently for everybody, but should you try it? Most definitely. And good luck with it, because you're going to need a lot of patience. But you'll find something, I promise. Take care.